Again, everybody. My name is David Martinez. I am your captain today. Happy Halloween. I have the great pleasure of being the director of our grants program and of our civic health portfolio at Vitalyst Health Foundation. I'm joined by my first mate, Michelle Goodthunder here, program manager for learning and evaluation. We will begin with some housekeeping. We have accessibility measures as needed for those partners that speak Spanish. Closed captioning is available. All the lines are muted upon entering the webinar, but we'll have a live Q&A at the end of the slide deck, so you can unmute yourself and ask your questions if you have that. But feel free to use the Zoom room to put in your questions throughout the webinar. And my first mate, Michelle, will be answering those as we go along as we can, or holding them until the Q&A as well. This recording, embarrassingly, will be recorded and posted to our website and to the email for all those that registered, including this slide deck and other materials regarding how Vitalyst operates and our grant partnership opportunities. But for those who don't know, Vitalyst Health Foundation is based here in Phoenix, but we have partnerships all across the state of Arizona, all with the vision that all individuals and communities in Arizona are healthy and resilient. We are on a mission to connect, support, and inform those efforts that are improving the health of individuals and communities throughout the great state 48. But we see health as more than just healthcare. Certainly a very important aspect of it. And as you'll learn in a little bit, it's an important aspect of our portfolio work as well. But a lot of folks might have seen the WIL, as we affectionately call it. It reflects all of the elements of a healthy community, or the social determinants of health. The social indicators of health is what a phrasing I'm hearing more often too. That reflects, all components of these aspects, these spokes of this WIL, encompass some integration with health. And at Vitalyst, we really do look at that integration, that health is in all policies, health is everywhere. And we especially want to continue to center our lens around health equity and resilience. So when you're first questioning, is my organization, is my effort aligned with Vitalyst? We look at the WIL and efforts that are improving health, again, the broader elements of a healthy community, to check for that mission alignment. If you don't see your work in this WIL, it's likely because it's rolled up into one of these hubs. So if you go to vitalysthealth.org, there's a deeper dive into the WIL where you can look at each of these hubs and really begin to drill down into what actually does parks and recreation mean. And if you're working in outdoor space and green space, conservation, all of the sustainability, those aspects, it may be included in parks and recreation, and then note different health indicators and health outcomes within that sector and spoke of this elements of a healthy community wheel. Vitalyst operates in three ways. We support collaborative networks, but we recognize that those networks are still made up of individual organizations. So we work to strengthen community partners as part of those collaborative networks as well. And we work to inform decision makers. These goals really drive the activities in all of our priority areas, especially, and in our grant programming. So Vitalyst as a health foundation works in what is often called an upstream fashion. So we are looking at what are those policies and systems that are in place that are keeping a barrier in place that is restricting our ability or communities' ability to improve health in their communities, of their people, and of our states. That upstream mechanism tackles the root cause of problems often, and it's heavy work. So that's why we really focus on the collaborative aspects of our organization, still recognizing that those are all comprised of community partners that need to be strengthened as well. So leveraging some capacity building support in that way. And then, as I mentioned, the upstream interventions often include policy change. So we do robust policy and advocacy for Vitalyst and our priorities. but and encourage other nonprofits to do so within the guidelines, of course, and to tackle those kind of systemic approaches to improving health. So you'll see those three goals reflected in each of our three programmatic priority areas. I always like to say Vitalyst has kind of three sides to our house. We have our grant making side of our house, which we'll go into in a little bit, just like any other foundation. So we'll talk about that. We have our fiscal sponsorship side of the house, which is called the Technical Assistance Partnership of Arizona, or TAP-AZ. That's not reflected in this slide, but we do host another monthly virtual information session for TAP-AZ for folks that want to explore fiscal sponsorship. That's essentially back office finance and accounting support for organizations so that you can focus on your programmatic areas, your mission areas, while our TAP-AZ team builds up your capacity around that finance and accounting back office folks. So if you go to tapaz.org, you can learn more about fiscal sponsorship and sign up for that monthly virtual session as well. And then the final third side of our house, as I like to frame it, is our programmatic priority areas. So this is where we operate a little bit differently than a traditional grant-making foundation in that we leverage sometimes non-monetary resources in these key priorities that are top in our state. So as I mentioned, healthcare integration is really, really important, especially now with the pending Medicaid cuts. The healthcare integration portfolio is really about the intersection between the physical, the mental, and the social determinants of health. And I'll take a little bit of a deeper dive into this in just a little bit. Housing, as we know, is a crisis across the country, certainly here in Arizona, both urban and rural communities. So we have a whole portfolio area that works with collaboratives, with partners, and advocacy in our housing portfolio as well. And then the third priority for Vitalyst is a portfolio that I also oversee in addition to our capacity building and grants program, and that's our civic health program. That really is all about how communities are coming together to tackle their toughest challenges. And since we're a health foundation, how those collaboratives are working to improve the health of their neighbors, their communities. And we think that'll help improve improve the health of our state, our country, and our democracy. So our more programmatic work, those priority areas are each overseen by a director at Vitalyst that you might have met out in the community or had a conversation with. So as I mentioned, I direct our civic health portfolio, and there's my mug there. Our awesome director, Anna Rossetti, leads our healthcare integration work, again, focused on that integration of the physical, mental, and social determinants of health, especially right now focusing on Medicaid and the great partnerships that we have with our community health centers throughout the state to brace for the cuts that are coming through our state health insurance program called Access and Kids Care for Children, working to ensure that those navigators and those community members can access quality, affordable healthcare as we navigate the cuts again. She also does a lot of work around emerging public health issues, especially on high priority areas for our state, like maternal health, heat resilience, healthcare workforce. So does a lot of work, again, in collaboration to strengthen community partners and a lot of advocacy and public policy in this space. Our portfolio for housing is overseen by that handsome devil right there, Gabriel Jaramillo. He is a great local expert in the housing space, and we're glad to have him as part of our team. His work is really about showcasing those promising practices that can be leveraged to address our affordable, especially workforce housing crisis here in Arizona. So really highlighting again these collaborations like the Arizona Housing Coalition and other housing partners to showcase some really awesome policy and systems change happening in the housing space, especially connecting what we call anchor institutions like schools, churches, community colleges, health centers to leverage their vacant property and connect them with nonprofit affordable housing developers to build affordable workforce housing on that property. It's really cool, and we have examples across the state of that, including Flagstaff, the White Mountain areas down in southern Arizona, and here in hyperlocal spots in Phoenix. Really, really awesome work that Gabriel is leading. And then our colleague Sergio here, we wanted to show him some love. Sergio Paris, he is our Director of Strategic Communications. He helps amplify all of these messaging, but we especially wanted to showcase him because if you are working in areas around education or food systems, those are areas that he has background and experience in. So as you reach out to Vitalyst and my Explore partnership in those areas, you'll have those conversations with Sergio. I'll describe that in just a little bit because seeing everyone's face will match a topic that we'll talk about as part of our discovery process. So that was our programmatic side of the house, where we have identified those three key priorities that we intentionally do mostly non-monetary resources to. Staff leverages our time. We do a lot of research, data collection, a lot of advocacy and public policy. But even if you don't work in those three areas, you can still collaborate or explore partnership, discover partnership with Vitalyst Health Foundation through our grant making side of the house. So this is what we're going to get into now. The grants program at Vitalyst Health Foundation is set up to support collaboratives working to implement a systems change. We recognize that systems change, as I mentioned, those upstream interventions that are addressing root causes of Arizona's greatest health disparities is heavy work. They take a lot of time and need a lot of resources. So we essentially have built this three-tiered grants program that provides you an opportunity if you start in the first tier with upwards of a 5-year partnership potential with Vitalyst for upwards of $225,000. Each tier of those of our grants program is still a competitive grant cycle that we'll take a deeper dive into in just a little bit for each of these. But the first tier is our technical assistance grants meant for collaborative capacity building. This is the first tier. The second tier is the Spark grant, which is more of a planning grant for those collaboratives to think through the specific interventions or solutions towards systems change. And then the third tier is our larger systems change grant, which is a 3-year grant meant for collaboratives who have built their capacity, they've done their planning, now they're ready to implement their systems change solutions. So again, a 5-year partnership opportunity, but you don't have to start at square one. If you don't need capacity building support for your collaborative, you could jump straight to the Spark grant. Or if you've already done your planning and built up your collaborative, you could jump straight to the systems change grant. You don't have to start from square one. We explore and discover those partnership opportunities, those grant partnership opportunities through what we call our discovery process to discover partnership. Vitalyst has an open door policy, so we welcome folks to reach out to us to discover this partnership, and we use this process to begin to track those relationships and align and find alignment, see alignment with your efforts and grant partnership opportunities as they exist, or connect you or refer you to other resources that might make more sense and are more aligned than what Vitalyst might be able to offer. So as you're going through this session today and you're thinking, yes, I definitely see some alignment, I want to reach out to you, go to vitalysthealth.org, the grants and partnership webpage on there. You'll see the discovery intake form. It's a quick 10-minute form, just collecting some basic information about your work, your efforts, and how you see alignment with one of our grant partnership opportunities. And then as soon as you submit that, we receive it, review it, and if there is alignment, we send you a follow-up prompt to schedule a time to chat with one of those fine faces that you saw on the slides before. So either myself, Gabe, Anna, or Sergio, or even sometimes my first mate, Michelle, if it's kind of a catch-all or we're uncertain about where we might direct the next step conversation. So those initial consultations are had by all of our team members to be able to take a deeper dive into what you submitted in your discovery intake form, collect some more information, really see alignment with one of our grant partnership opportunities. And if that is the case, then advance you to the next steps, depending on what the specific grant type is. So now let's take a deeper dive into each of those three grant types. As I mentioned, the first tier is our technical assistance grant, which is meant to support collaborative capacity building. We've heard a lot of feedback over the last 10 years that we've been administering these systems change grants that collaboratives need space and grace to build up the trust, the infrastructure, meet the specific technical assistance needs that you have and that are so critical in a collaborative. Because if you've worked in coalitions, you know it's hard work. Everyone is coming to the table well-intentioned, but still representing their own organization, wearing their own hats to and bringing that to the table and needing to think through what it's like to work in a coalition, in a collaborative. Also, collaboratives are so important to help plan and implement systems change because, as I mentioned, systems change work is heavy work. It takes a village. It takes more than just one, even strong organization to see it through. It takes a collaboration. You'll see that theme throughout through our grants program because, and even in our programmatic areas, as you saw, it's a goal of Vitalyst, supporting collaborative networks. And it's so important that it is one of the 5 criteria of our grants. We have the same 5 criteria for all 3 of our grants. The work has to be done in collaboration to achieve a health outcome using a systems change lens with a health equity frame, and each of the grant proposals has to have a budget that aligns and matches the proposed scope of work. And we'll go into each of those because the criteria, while they remain the same 5 across the 3 grant types, it really does depend on where your collaborative is in your journey towards systems change in the systems change continuum to determine what the specific questions and criteria aspects are. So for instance, with the technical assistance grants, this is meant to be a collaborative capacity building grant. So it doesn't mean that your collaboration is formed. And so the criteria around collaboration can be at the beginning stages, including simply being, in this case alone for technical assistance grants, a single lead organization, a nonprofit or fiscally sponsored organization serving Arizona to apply for this technical assistance grants. So at this stage, you do not have to have 2 or 3 or more partners. You can simply be one partner looking to expand the collaborative, and that's how the funds can be leveraged. This collaborative criteria also is a big aspect of the technical assistance grants because it is meant to build up your capacity in this area. So, so we work with you to identify what are those specific capacity building needs that your collaborative has so that the funds can then be leveraged to meet that specific capacity building need. And that can look like a lot of things, right? It could simply be working to identify who those collaborative partners are. This is a really important piece because we really do look at quality over quantity, which means especially as you're thinking about your potential systems change and the system you're hoping to change, who are the right people, the right organizations that need to be part of the collaborative that will help drive the specific interventions or solutions towards systems change. So for instance, if you're working in the education system, you probably want to engage the education system itself, school district folks, educators, students, parents, maybe the school boards or the superintendents, maybe all the way up to the state level with the State Department of Education or the State Board of Education, again, depending on what exact system you're hoping to change and what specific interventions and solutions you're thinking of. So that is a really big aspect of collaboration. Of course, the work has to be working to improve a health outcome. Later on in our grants, you should be getting to a very specific health outcome Again, this health outcome can be tied and should be tied to the will, that element of the healthy community will that I showed you earlier. Again, at this stage, you might be thinking about broader health outcomes, but you should be thinking about the more specific health outcomes that you want to address in a systemic way. So, for instance, if you're working to, say, improve diabetes rates in Arizona, that's awesome, but we'll want you to drill deeper. Who are those, what are the populations, the communities that face the greatest disparities in diabetes rates in Arizona? So maybe it's specifically working with tribal communities where the data shows that those rates are higher or whatnot. So again, getting really down using disaggregated data and a health equity lens to really address that health outcome criteria. Our grants program is framed to support systems change. So the technical assistance grants isn't just to support collaborative capacity building for those coalitions that are just being formed for good work or direct service or coordination of services. It really does have to be for a collaborative forming to eventually plan and implement a systems change. So the systems change criteria is a key aspect of it. But you don't have to, again, know your specific plan or the specific implementation measures, because that's what the Spark and Systems Change Grant is for. You at least need to know what system you're hoping to work in and hoping to change, and maybe some initial ideas about what your efforts will look at and tackle. But again, the Technical Assistance Grant is really meant to help build up the capacity of that collaborative to eventually plan and implement a systems change. Health equity is a very foundational value for Vitalyst. It's reflected in all of our work, even operationally, and it's reflected in our grants program too. So we have a criteria around that. That could be seen in a few different ways. One, for the technical assistance grants, it's really important because, as I said, those closest to the problem should be closest to the solution. And that means from the beginning. You have to engage those with lived experience, those closest to the problem as closest to your solution from the beginning, include them in your collaborative and help and have them be part of your addressing the system that they themselves are in and finding challenges with. It could also be exposed, as I highlighted for the health outcome criteria, around how you're using disaggregated data to specifically hone in on the specific health outcome, the specific population and community that you're hoping to improve. Your work might be very hyperlocal, and systems change work can certainly be hyperlocal. So for instance, we see if you're working in conservation or sustainability, air quality, environmental quality systems, you might think or see that, it's hotter in the Maryvale area here in the Valley of the Sun, right? So I'm going to focus in Maryvale. At the same time, we know that the system is much larger than that hyperlocal effort. But if you start there, it's fine. But it could be broader to impact the broader environmental system in Arizona, or even just regionally or whatnot. So you can begin to expose what that disaggregated data is showing you and how you're holding a health equity on that lens. And then for the budget with the technical assistance grant, again, it has to be consistent with the proposed scope of work, especially around that collaborative piece. The technical assistance grants are up to 1 year and up to $20,000. So what does that mean, up to? When you're having a conversation with our directors, we really try to identify what are those specific capacity building needs you have, and what are the specific what's the specific support and expenses needed to address that specific capacity building need. This is also often highlighted because the technical assistance grants are often leveraged by our lead applicant, our community partner, by contracting with a strong local consultant or coach that has experience in addressing that specific capacity building need. And in working with that consultant, they will likely draft a proposed scope of work with some key deliverables, the anticipated timeline, and what their compensation will be to help address that specific capacity building need. And that's why we say up to, because sometimes the grant covers the compensation of that consultant, and the amount might be less than $20,000, right? That's what the grant will help cover. So it might be $12,000 for a series of community conversations over the next 6 months or whatnot. So the grant would be for $12,000 for 6 months. So that's what we mean when we say up to 1 year, up to $20,000. Still, we recognize that the collaborative capacity building needed for this effort is hard work, and it can take up to a year, and it can take up to, and probably even more than $20,000. So if that's where you're at, then we welcome proposals for a year and for $20,000, but really try to work with you to identify those specific capacity building needs. As I noted, we have an open door policy at Vitalyst. So we explore our technical assistance grants partnership opportunities through that discovery process. So if you see alignment with this grant type, go to vitalysthealth.org, our grants and partnership webpage, and fill out the discovery intake form and select your interest in a technical assistance grant. We'll receive it, review it. If there is alignment, then prompt you to schedule a time via Calendly. We use that tool to schedule with, again, one of my colleagues or myself for that initial consultation. Once we have those discussions with you and our staff to see alignment, that's where we really begin to take a deeper dive into what your proposal would be. If there is alignment, the director will invite you to submit a draft proposal for their review. And this is often just done via email to really think through what your proposal is, and if there is indeed alignment with the 5 grants criteria pieces of it. And they will likely provide feedback on how to strengthen that proposal so that it is as strong as it can be. And then once it gets to a position of being a really strong proposal, they'll then send a formal invitation to you to then submit that proposal in our grants management system called the Koya Go, which is an online portal, so that we can then do internal review process for our technical assistance grants. The technical assistance grants do not have to be approved by our board. So we have an internal review process made up of our team here at Vitalyst and TAP-AZ who reviews those technical assistance grant applications. And then as a team, we reach consensus on whether to fund or not. Because they don't have to be approved by our board, we do not have these technical assistance grants on a grant cycle or with a grant deadline. So we review these throughout the year through our discovery process. And then as they come to our team, we usually have a pretty quick turnaround, usually within 2 or 3 weeks, to allow our team to review the applications and then come to a decision, a consensus pretty quickly thereafter, and then can begin the grant partnership soon thereafter that. So that was the first tier, the technical assistance grants meant for collaborative capacity building. The second tier grant, as you may recall, is a Spark grant, which is meant as a planning grant. Again, hopefully your collaborative has built a capacity, then you can move into the Spark grant conversation, which is meant for a bit more strategic planning of that collaborative to think through what are those specific interventions or solutions for systems change, and what is the plan we need to put into place to be in a better position to implement it later on. Again, you'll see the same 5 grant criteria for the Spark grant: a collaborative to improve a health outcome using a systems change lens and a health equity framework, and a budget that is consistent with the proposed scope of work. So in this instance, again, the collaborative should be formed. The capacity has been built. There, of course, is ongoing capacity building needs as needed throughout the planning and implementation phases. So it doesn't mean you have to have, like everything buttoned up nice and neat. And if you know collaborative work, coalition work, there's no such thing as nice and neat. So there could be some building needed to be done, but at the very least, the Spark grant should have at least 2 partners at the table. Again, quality over quantity. Who are the right people, the right organizations that will really help the planning and implementation of this effort? So the effort around collaborative shifts a little bit from the technical assistance grants, but it's still a really important aspect of it because we really want to ensure that quality and engagement is happening. The health outcome obviously is the same. And again, you begin to move to narrow in and become a bit more specific about that specific health outcome you're hoping to achieve using the will to show that integration as well. Similarly, for your systems change, right? You should be moving a little bit further on. You know the system you're working in, but what are those specific barriers that are keeping the system in place, the barriers are in place that are prohibiting your work to improve health and tackle those root causes of the health disparities that we see in our state. The health equity piece, very similar, a little bit shifting, especially with your continued engagement with communities, members, and those with lived experiences. And again, focusing even more so on your use of disaggregated data, I'll get that word right eventually, to really focus in on the population and community you're working on. And then for this, again, a budget that is consistent with the proposed scope of work. The Spark grant is a one-year grant of $25,000, again, meant to be a planning grant. And for this, again, we start our process to discover a Spark grant potential through our discovery process. So go to vitalysthealth.org to complete the discovery form, select interest in Spark grants. We'll receive that form, review it, and if aligned, you'll receive an email to schedule a time to chat with one of my colleagues to take a deeper dive into see how there might be alignment with the Spark grant. For this, again, there could be this back and forth with reviewing the draft proposal. And then once the team member discovers that, yes, this is a strong proposal for a Spark grant, they'll then invite you to apply via our grants management system, Akoya Go, an online portal that we then begin to review through our process. The Spark grants do have to be approved by our board. So this is a grant cycle that we run on. However, we still review these opportunities, discover these opportunities throughout the year. So it's an ongoing review. So as you see, we've already passed our fall deadline for our Spark grants. But that doesn't mean we can't have a conversation with you because we'll just tee you up for the next grant cycles we have. The next one that's published is in the spring, but we may have an opportunity in Q3 of 2026, so January and February, to explore if it's a more urgent need. But these are the grant cycles that we opened up our fiscal year with. So you've formed and built the capacity of your collaborative. You've done your planning with that collaborative, continue to grow and hone in on those specific plans for system change. Now you're ready to implement your system change, and that's where the system change grant comes in. The system change grant, as I mentioned, is an implementation grant. So you are ready to go. You have your interventions and solutions in place, your plan in place. Now you need to execute the plan. So for this, you see, again, the same 5 criteria. This is where we get a bit more specific with the criteria pieces, because as you'll see in a little bit, this is a 3-year grant for $175,000. So more resources to help you implement the systems change effort and a little bit more of a review of the efforts. So for this, the systems change project design is so important because this criteria at this point of the grants program, you are ready to go. You should know what systems change you're hoping to achieve and implement. You've already done your planning. You've already built up your collaborative. You know exactly what your efforts and your projects to address systems change are. This criteria also ensures that your effort is actually systems change because again, that's what our grants are supporting. And we have done a lot of efforts over the past year to help folks better understand what system thinking and systems change is, to see if their work is actually systems change. Again, that upstream intervention rather than a downstream intervention, which are still very important, but are more of the more programmatic or direct service works, which we don't support. So if you are exploring during this webinar, gosh, I'm not quite sure if my effort is systems change or not. If you're seeking funding for a program or a direct service, it likely is misaligned. But again, if you go to vitalysthealth.org, we have a webpage filled with resources around how we frame systems thinking and systems change, including previous webinars that are recorded, a podcast, a white paper that we call a Spark report that goes a bit more in depth, visuals, and different frameworks. So hopefully you can navigate through that and really think about if your effort is systems change. At this point, the collaborative criteria piece is a really a strong aspect as well. Your collaborative should be formed. The right people are at the right table and they're ready and committed to helping you implement your systems change. Also, for the health outcomes, you should be really honed in on the specific health outcomes you're trying to achieve, and also tying in that health equity criteria in this aspect. And connected with the health equity criteria, continuing to engage community members that are closest to that problem and closest to the solution that you're working to implement, and even a bit further, perhaps, continuing engagement with community, even beyond those you've engaged through community learnings or engagement as part of your implementation effort. And then for this, the budget also is a bit more thorough because it's a 3-year budget for $175,000 total. So how are you expending that $175,000 over 3 years? And we actually have budget templates for this application as well as for the Spark grant as well. Similarly, we discover the systems change grant opportunity through our discovery process. So folks can go through that process itself. However, our systems change grant is an open process. So even if you don't go through our discovery process, you can still submit an application for the systems change grant. But as you see in the timeline there, our grant cycle for our systems change is past. It's an annual cycle and it has to go through our board as well. And we have a more thorough review because it's a higher amount and a higher time frame. So we have a bit more of a thorough review process that engages our board much more closely. So you're welcome to complete a discovery form, even recognizing the deadline has passed, because next year we'll go into a new grant cycle and maybe discover through those conversations that maybe your effort is aligned more so with the Spark or technical assistance grant at this point. So that was a quick overview of Vitalyst Health Foundation, how we operate both programmatically through our housing, healthcare, and civic health priorities, and then a deep dive into our grant side of the house with our technical assistance grant, Spark grant, and our systems change grant. If you want more information about especially our systems change grant, even though that cycle is closed for this fiscal year, for us, we run on a July 1 to June 30th fiscal year. Still go to the vitalysthealth.org website and the specific web page for systems change to learn more about systems change and how your effort might be aligned in that way so that we can begin those conversations. With that, Michelle, were there any questions during the presentation that we can address?
No, no questions in the chat.
Awesome. If folks have questions, this is the live Q&A portion. So feel free, if you're embarrassed or on mute or off camera, utilizing the Zoom room, and we'll read the question and answer it to the best of our ability. But if you have a question and want to come off of mute, feel free to raise your hand or simply come off mute and ask your question. It's a quiet crowd. Nobody has had their Halloween candy yet.
Hi, David. This is Amy Lyon with Vitalyst Foundation.
Hi.
Hi.
We often get confused. You
It's a
won't.
little close. It's a little close.
So many people are just like, since when does a blood bank do
Right.
grant making? And I'm like, first of all, Vitalant is much more than a blood bank. So thanks for all you're doing in the community.
Oh, thanks. You guys as well. I know that the name is it's meant to be. So I just want to clarify. It sounds like what you just went over. Every single grant opportunity, the nonprofit has to align or collaborate with a different, is it an organization, a different, I mean, what are the boundaries of that collaboration and how tightly are you having to be connected to them? How much involved are they? Just trying to get a better understanding of that piece.
Absolutely. Great question. The collaborative piece is a really important aspect for our grants program. As I mentioned, system change work is heavy work. It takes a village. That collaborative piece is a goal for Vitalyst in all aspects. So again, we really focus on who are the right people that will help you drive the specific interventions or solutions of your systems change. And that should determine who is at the table. The who can be a variety of organizations, not just nonprofit organizations that can help implement that work. So in many instances, like or they might be like traditional nonprofits, but we have a lot of university or college partners, government partners that have been part of coalitions, especially if that's a system you're working in. Um, uh, there can be, in some instances, for-profit entities that are part of your collaborative that are really instrumental to helping you implement your systems change effort as well. Certainly, community members are an important aspect of your collaborative as well, and that's an important aspect of our health equity lens as well. The big thing that we often see that is included as a collaborative partners are those folks that are helping you do the work, but more so like on a fee for service mechanism. So like a consultant wouldn't necessarily be a collaborative partner because they're helping you do the work, right? It's like hired. They're leveraging their own experience and background, and the grant may be leveraged to compensate them for their time and expertise. So in many instances, that isn't a collaborative partner. Obviously, still though helping implement and achieve it. But we really do want to see who are those organizations, the entities that are really, really needed to achieve the systems change.
Thank you.
Yeah, thanks for your question, Amy. Caprice, you were a little bit spotty. Maybe you were just coming onto audio.
Okay. Is this better?
It is better. Great to hear you.
Okay. I have two questions. What types of projects have been most successful in the past funding cycles?
Ooh, the most successful. Maybe Michelle has a good question. It's like choosing your favorite kid. Um, I would say a couple of key examples that have been successful systems change are we had a collaborative that included the U of A, Shot in the Dark, Sonoran Prevention Works, Southwest Recovery Alliance, and a lot of other harm reduction organizations that worked to repeal a state law that prohibited syringe access programs in Arizona. So there was actually a state law that said you cannot exchange clean needles as part of harm reduction practices. When the data and public health research showed that the syringe access programs are an on-ramp to substance use treatment and prevention, and is where it's legal has been proven to be successful as part of that system, which of course leads into the criminal justice system. So they worked to repeal that state law, and they were successful. It doesn't mean they were a systems change grant partner for 3 years. they had been working for like 10 years before that, right, to bring those partners together, to plan their systems change. And their victories were really small. Their North Star was repeal of the state law. But like in their first year, they were simply just trying to get a meeting with the chair of the Senate Health Committee, who was like adamantly against syringe access. Because, there is this stigma and this mental model that needs to change around harm reduction practices. Because if you hear like you're handing drug paraphernalia to a drug user, it sounds counterintuitive, right? But the data, the public health research shows that it works to get them into treatment and other wraparound services so that they can come out of substance use and recover. So their initial goal was like just get a meeting with the Senate health chair and begin to provide her with research. And she eventually did. They met with her. There was still a lot of work to be done there. Then the next step was to allow her to call a hearing for the bill, which was a huge achievement. And then once they had a hearing, they had to get the votes of all the other committee members, right? And then once it passed committee, they had to go to the full Senate and get the 30 senators in Arizona to vote supportive of it. And then once that happened, it had to go over to the House and begin to go through that whole process again. And when that happened, it went up to the governor, who could have vetoed the bill as well. So there's a whole advocacy strategy, but ultimately it was successful. So that's one of a really awesome one. Michelle, is there one that comes to mind for you?
Yeah, I think the other one I'll mention is Circles of Peace in Nogales. And they were really successful on providing education to first responders, such as police officers, and endorsing trauma-informed care and how to work with the community and just have this wholesome wraparound care. So now they're trusted partners where police or first responders come to them for training material. And they even have like first responder therapists within their building. So they have really good collaboration throughout the community with the end goal of making sure their youth, trying to reduce drug usage with their youth, build trust, and make sure crisis trauma-informed care is being issued by the first responders.
Great example. That also showcases the different types of collaboratives that we work with, the different health sectors that we work with, and the different areas of the state that we work in. So the effort, as I mentioned, with syringe access was a statewide policy, so it certainly can include policy. But as Michelle highlighted, the collaborative led by Circles of Peace in Nogales, what didn't focus on policy. Systems change does include policy condition, but there are other practices, relationship flows, mental model shifts that are included as systems change. And if you go to vitalysthealth.org, our systems change webpage, you'll see this visual that you can see how we frame systems change as more than just policy and practice change, because those are the easiest ones to see. It's the other resource flows, power dynamic shifts, relationships and connections, and then the most transformative systems change is that mental model shift, changing hearts and minds. So check that out. Caprice, did you have another question?
Um, does Vitalyst consider coalition proposals, in healthcare, but specific cultural purposes? Is that
Specific cultural purposes. Can you
their
elaborate on that?
priorities? Yeah, so our nonprofit is specific for AIAN and
Mhm.
cultural integration of traditional healing as a modality in substance use mental health counseling practices.
Love
So
it.
I just want to make sure that wasn't an exclusion.
Yeah, I think we'd be happy to have that conversation with you, especially our colleague Anna, because she's done a lot of work in this space. Two examples of efforts that we have invested in similar efforts, not exactly that one, but you'll see, I think, a connection is so awesome. The state of Arizona Access now reimburses tribal healing practices, which is really great. That's being funded and implemented this year after seeing policy and practice change, which is awesome. And then another one that actually is on their second system change grant is a coalition led by Arizona Coalition for Community Health Workers. So this is all about changing the concept of community health workers, CHWs, promotoras, or CHRs, community health representatives on tribal lands, as medical professionals. There's still a lot of changing hearts and minds for them to especially convince doctors, MDs, that they're truly qualified medical professionals. And then the policies, practices change that needs to happen. They were really successful because they wanted to get access reimbursement for CHW services as well. That's a resource flow change. That's a systems change condition. But in order to get that reimbursement, they had to be licensed. There was no licensure for CHWs, and they worked to pass the law and are now working with the Department of Health Services to now create the practices, yet another systems change, to work with county departments of public health to implement that systems change.
Thank you so much for those answers. I appreciate it.
Yeah, thanks for all your work. I'm excited to learn more about that. Any other questions? Well, even if there's, oh, Melissa, go for it.
Hi, good morning. Thanks so much for the info. I just want to jump in because I'm part of a university system, which is kind of like its own little city. And so when I think about collaborations and collaborative partners and opportunities to improve health outcomes for our students, I'm wondering if you all consider, with the coalitions and the collaborations, could it be different entities and units, functional units within the university system coming together to collaborate on an issue? Like, for instance, particularly food insecurity is pretty high at NAU. And I think maybe a look at policies and practices could maybe help reduce that. And it might sound like, hey, you guys already work together, but nobody really talks to each other. So, would that be considered a qualifying type of collaborative structure?
Yeah, and you don't have to tell me twice about the university bureaucracy for sure. I would say we certainly could be open to it. I think the question is for your specific example, right, of food insecurity, like at NAU among students, and we see this across the board. Unfortunately, U of A has a campus pantry, so we would then look at, okay, what are your interventions or solutions, your system change approaches, and are those university partners the only ones that are actually going to help change the system? And in the discovery consultation call you'll have with a director or with a team member at Vitalyst, if it's food systems, it'll be with Sergio. He'll ask you these questions, and I know he'll be like, well, are you talking to Flagstaff Family Food Center? Are you talking to the Arizona Food Bank Network? Are you talking to Pinnacle Prevention, Activate Food, all these food system partners that are doing work in Northern Arizona, and that can help drive the systems change piece. A lot of those partners I just mentioned are actually grant partners as well. So you definitely can be connected on that front with them. So it really does depend on what your systems change is, and really think through, our university partners the only partners that are going to help achieve that. The other things I'll mention with this is, again, that health equity piece. How are universities engaging communities and community members with lived experiences in your issues? We see that disconnect happen a lot with universities and colleges. We get it. It's challenging work, but it's so important. The other very, very important budget piece for you to reflect on is one of the, we do not allow it for our grants, university indirect. So we work with the partner, and it's incumbent upon the partner to work within their own institution to navigate that. We have granted to universities as a lead applicant, and it's usually through sponsored projects, their Office of Sponsored Projects, or their foundation, or sometimes even through the Board of Regents as the lead applicant. So it's a little bit high-end review. And with universities and colleges, because you are such large institutions, we really do look at that health equity lens and if the university should be the lead applicant in the first place. So just a couple of things for you all to consider. But of course, this is what the discovery call is for, to have these open, frank conversations, because if there is alignment, we really do try to get you to a good spot for your proposal.
Thank you.
Yeah, thank you, Melissa. I saw another hand up, but not anymore. Any last minute questions? Awesome. Well, thank you all so much for starting your Halloween with me. This is your captain, David Martinez. As I mentioned, we have an open door policy. So even if you think of questions after this, then feel free to reach out to us. Certainly check out vitalysthealth.org. And as you see alignment with one of our grant partnership opportunities, complete that discovery form. I hope you have a safe and healthy Halloween and rest of the season. Take care.
Thank you.